may have heard about this warning that came out last week from the Minnesota Board of Animal Health, warning Minnesotans about a high prevalence of canine brucellosis from dogs originating in South Dakota. Joining us now to talk more about this from the Board of Animal Health, Dr. Steve Kivisto. Thanks for waiting to get on with us today.
No, I appreciate it. Thank you for having me on.
Let's start with telling people exactly what canine brucellosis is.
Um, Canine brucellosis is a bacterial infection, and it's caused by a bacteria called Brucellosis canis in dogs. It is more commonly found in dogs that are intact, that have not been spayed or neutered. Historically, we had seen it more in dogs used in breeding facilities or for purposes of breeding. And the common clinical signs that breeders would report would be reproductive failure, so miscarriaging, failure to become pregnant. What has changed over the last probably 5 years or so, we've seen a shift in the population of dogs we've seen it in. So instead of dogs being used for breeding purposes, with the opening up of dogs being rescued from southern states. You mentioned South Dakota, but also Texas, areas that maybe have especially a large stray dog population problem. We're seeing a shift in the demographic of dog that is coming down with brucellosis.
Okay, and I see in your stats so far in this year in 2026, 7 canine brucellosis positive dogs traced to South Dakota. Can you put that in perspective in terms of those numbers versus other years?
Yeah, so it seems like this. So this early in, so we're halfway through 2026. So I would say 2022 was a landmark year, if you will. We had over 40 some cases. So we are, knock on wood, not on track to meet that kind of number. But it's definitely higher than what we would typically see in a year. An average year, over the last probably 5 years, we may see 5 cases of brucellosis for the entire year.
Okay. So in putting out this warning, what do you want people to know if they're bringing in dogs, whether it be from South Dakota or other out-of-state areas? What do people need to know in light of this warning?
Well, we don't want people to be overly alarmed. We certainly we recognize the need to help these animals from areas that they don't necessarily have the same facilities, the same ability to find homes for these animals in need. We just want potential pet owners, veterinarians to ask the right questions. So if you're adopting an animal from a rescue, or you're getting it from a breeder for that matter, ask, where did the dog come from? Has it had any kind of testing done? Any kind of routine vaccines, treatments of any sort? Just to be aware, to know that brucellosis does exist, but there are also other infectious diseases out there that exist as well. And the more you know, the more questions you ask, the better it will be, not just for the owner, but brucellosis can be a difficult diagnosis to make. My years in small animal practice, I don't know that if I've seen a case or two, probably not more than that. And so it's easily missed. But if your veterinarian is aware of where your pet came from, what its history is, it would at least be on a list.
On the radar, so that they know to look for it. Dr. Steve Kivisto with the Minnesota Board of Animal Health, thanks for being with us today.
It was my pleasure. Thank you very much.
Appreciate